Hello and welcome to our compliance update for 2018. This is basically a summary of the essential information you need to know. Greater details may be found on our website, through your licensure law books, through the employee handbook, and on some of the different websites that are noted throughout this presentation. So our compliance program, just to define it, includes internal audits, adherence to regulatory guidelines, and careful education on areas found to need further training for our therapists. Our company performs several audits to ensure the integrity of our work. Several reports are accessed through Optima, and that enables us to monitor and counsel different teams as needed so that we can promote strict adherence to all of the regulatory guidelines we need to follow. Regulatory guidelines are monitored through our company, and that includes resources from CMS, CGS, Palmetto, managed care companies, licensure laws, and some others. We are a member of several national organizations to keep us informed and help keep you informed of all the updates you may need to know. We share this information with your FRC, or we provide that information through CEU 360. And we also hold some training on site from time to time, and we certainly use media such as this webinar today. So thank you for attending. Our compliance program also includes a prompt response to concerns. We have an open door policy, and there is a compliance alert button on our website. So once a concern is shared with a member of our corporate team, concerns will be quickly investigated and acted upon as necessary. We have an open door policy, which means that you may share concerns with anyone on the corporate team with no concern for retaliation for this communication. And if you're uncomfortable reporting a concern to your immediate supervisor, which is usually our usual recommended course of action, you may certainly connect with anyone on the corporate team. And again, there will be no retaliation for that communication. On the website, if you look under the employee portal along the left-hand column, towards the bottom is a compliance alert button where you might either anonymously or identifying yourself provide information regarding a concern you may have. So licensure laws, we'll touch base on that briefly for starters. What is the most recent publication date on the Ohio Occupational Therapy and Physical Therapy licensure laws? What's the most recent publication to date for Ohio OTs and PTs? We're going to ask some questions throughout this presentation and get to the answers as we get through the end of that segment. So I'll get back to that in a minute. So for Ohio licensure laws, for OTs, the co-signature alone does not demonstrate adequate supervision of the OT assistant. For OTs and PTs and assistants for both disciplines, the website is that otptat.ohio.gov to see the laws and rules pertaining to your discipline. You need to know your laws and your code of ethics. Each employee is responsible to knowing that information. And we're going to touch base for a moment about transfer of care as well. If you're not the supervising OTR or physical therapist for a facility, you should document a transfer of care to your facility's primary or supervising therapist. Excuse me. You may need to state this patient's care transferred to the facility's supervising OTR/physical therapist. This patient's care is transferred to the facility's supervising OT or PT. If you don't know their name. If you do know their name, it's better to transfer directly. OTs, remember for the assistants within their first year of practice, weekly supervision must be documented. And this can be done through a supervision log, which is housed under that OT website above. Or you can be sure that a progress note is done weekly with the supervision section, including communication or consultation has occurred. And with all other progress notes for both OTs and PTs, we also need to have in the supervision section an indication of communication or consultation so that we can comply with the regulations for Ohio physical therapists, occupational therapists, and assistants. In comparing the two between what's allowed for OT and PT regulations, there are some similarities and differences. So assistants may not provide a home visit with the patient present or a home eval with the patient present for Ohio physical therapy assistants. For Ohio physical therapy assistants, the first year of supervision has the same guidelines as all other years of practice. And the PT assistants may note physician orders when the physical therapist is not available. However, they may not interpret or alter those physician orders. And PT assistants, you need 12 contact hours to renew your license in the state of Ohio. For OTs, the assistants may provide home visits with the patient present, They can document collaboration with the OTR for their recommendations. And that's real important as we look at home visit documentation. When the assistants are making recommendations to protect your license and to be in absolute compliance, you need to connect with that OTR, review what you're feeling is appropriate, and document that you've had that collaboration with the OT for those recommendations. For the first-year therapist, again, we need to have that weekly documented supervision, and we can have the OT assistants note physician orders, but there can be no interpretation, and OT assistants in the state of Ohio need 20 contact hours to renew their license, which includes an hour of ethics training. So May 1st, 2018 is the most recent publication date for OT and PT laws. Pretty current. For West Virginia therapists, the Physical Therapy Board is listed there. PTs and PT assistants both need 24 contact hours to renew their license. And there has been a change as of September of 2017, if it just didn't catch you last fall. The licensure fees have increased for physical therapists and physical therapy assistants, as noted on this slide. For the OTs in West Virginia, there's the licensure board for the OTs. Again, they also need 24 contact hours to renew their license, and there have been no changes to the fees for occupational therapists in the state of West Virginia. For speech-language pathologists, the laws and the rules for the Ohio SLPs can be found at the website listed here, and laws and rules for West Virginia may be found at a different website, and you have those resources then to confirm any regulations you may be wanting to be updated on. For speech therapists working with clinicians who are in their clinical fellowship year, if you go to the shp.ohio.gov site listed here, there are several forms that you need to be aware of and complete to fulfill that clinical fellowship year requirement for documentation. In the state of Ohio, CFY therapists also need a conditional license to practice. And ASHA has a really good YouTube video that goes over some basics, and that link is listed here. As well as on that ASHA website, there's a host of resources for CFYs as well as for seasoned speech therapists. So there's a lot of good information about updates and so forth out there on the ASHA site. Take a moment and talk about policy and procedure highlights. So understand that our policies and procedures apply to all of our employees and all students that we are working with. And I'm curious if you know for sure where you can find information about our policies and procedures. Where are those kept? So we'll talk about that in a moment. We'll touch base about the attendance policy. Employees need to report at their scheduled work time, and they need to work all scheduled hours. Full-time employees are expected to be available for up to 40 hours a week. And you need to remember that your patients are to be your #1 priority when you're in the workplace. That's what we're here for. That's what we want to prioritize and focus on. So excessive tardiness, schedule changes, or excessive absences may result in disciplinary actions. And to clarify a little further, you need to call off to your FRC by 8 a.m. on the day that you're ill, or you need to call off 1 hour before your usual start time if your usual start time is before 8 a.m. And as a reminder, 11 or more episodes of tardiness in a 12-month rolling period may result in disciplinary action, or 4 or more episodes of tardiness a quarter is just simply unacceptable. 7 or more unexcused or unplanned absences in a 12-month rolling period may result in disciplinary action. And again, 3 or more unexcused or unplanned absences in a quarter will violate our company's attendance policy. So know that attendance is monitored on a quarterly as well as an annual basis. Incidents. An incident is defined as any event that is not consistent with routine patient care. You need to report to the FRC whether or not there's an injury. You need to make sure that FRC knows about that incident before you leave for the day. And you want to document the incident report, or there may be two incident reports, the day of the occurrence, or at least as soon as able. If an event does not happen daily or is not part of routine patient care, excuse me, it is defined as an incident. Even if the facility does not immediately respond to the incident reporting, we need to document it and show due diligence in compliance. With incidents, if it involves a patient, we need to complete a facility and our corporate forms. If the incident involves an employee only your corporate form needs to be completed. Situations such as a near fall, somebody passing out or having a syncopal episode, skin tears, seizures, grand mal, petit mal seizures, those are all examples of incidents. They should not be a part of your routine patient care, right? So those are the things that we would document in an incident report. Resident abuse, our company has zero tolerance for any form of abuse, and this includes physical, mental, emotional, verbal abuse, sexual abuse, coercion, or exploitation. You need to report to the FRC within 30 minutes or contact your area manager or regional director within 30 minutes for any kind of witnessed or suspected situation of this nature. And again, you certainly need to report the situation to the facility. The facility designee or the administrator needs to address the situation with their staff and let them handle it from there. Again, be sure to notify your FRC or area manager, regional director immediately. With sexual harassment, we also have zero tolerance for any form of sexual harassment. And this includes at the workplace or in a work-sponsored activity that may be outside of the workplace. You need to contact your supervisor with concerns. Remember, we do have an open door, no retaliation policy with our company. And know that your concerns that are shared will be kept confidential as much as is reasonable to do so. So sexual harassment is defined as unwelcome sexual advances, requests for sexual favors, and or other verbal or physical conduct, especially if it seems to be made a condition of employment or a basis affecting your position within a company. And such conduct as sexual harassment has the purpose or effect of unreasonably interfering with your work performance or creating an intimidating, hostile, or offensive work environment. Again, zero tolerance for that type of behavior. Harassment may include verbal or physical conduct and or the display of written or graphic materials. Again, we have zero tolerance. Those situations need to be immediately reported to your supervisor. Any kind of situation that shows hostility, disrespect, or aversion because of race, sex, religion, age, color, national origin, or other protected statuses, again, is not tolerated. If it creates an intimidating, hostile, or offensive work environment for an employee, that needs to be reported, and it needs to be something that would adversely affect your employment opportunities. And again, that needs to be reported to your supervisor or to the corporate staff. Social media, again, it needs to be respectful of all colleagues, customers, patients, and residents. You need to not post any patient information on any of your personal social media platforms, and certainly social media is not to be accessed during work hours. Freedom of speech is certainly a right we all enjoy and share, but we also need to respect the privacy and dignity of everyone, our customers, our residents, and our coworkers. Check out our employee portal. We do have the essential policies and procedures listed there for all of our full-time staff members, all of our staff members. You just need to register to have access to the employee portal. You can certainly also ask your FRC to view a specific policy if it is not listed on the general employee portal policy and procedure access site. So again, all of our policies and procedures are hosted with our FRCs. The highlights are posted in the employee portal for staff, and you can check that information out as needed. A little bit of other information regarding courtesy. We want to treat everyone as if they were your mother or father. Remember, this is one of our corporate missions, that we do maintain and withhold this concept very dear to all of us. We want to convey a sense of hope and empathy to our residents and patients, and we want to promote a professional and respectful corporate culture. So that includes our customers, our colleagues, certainly the family members of our patients and our patients. We want to focus on the resident or patient. So be mindful about cross discussions that might be occurring in the therapy gym with your colleagues. Again, cell phones are not to be used in the therapy gym. You need to listen to our residents. Go that extra mile sometimes to help them out. It's a very difficult and sometimes a dark time for our residents. We want to be as supportive as is reasonable, okay? And we want to leave our personal concerns at home. They are our number one priority when we're on the clock. We want to touch base a moment about patient privacy and cybersecurity. So here's a quick little true or false fact for you. Healthcare is the 5th highest in ransomware attacks. Is that true or false? That cybersecurity is compromised in healthcare as one of the 5th highest sites for this to occur. True or false? So cybersecurity. Unfortunately, healthcare employees are an easy target for cybersecurity attacks. 2/3 of the attacks are preventable because we invite them in. So when you see a suspicious email, don't open it. What you'd want to do is to hover the cursor over the top of the name that the email is from, and you'll see the actual email address. And that can help you identify a potential hacker attempt, because if it's not the person you would expect it to be, it's not what it appears to be. When you look at that email address by hovering the cursor, don't open that email. Okay? We are distracted at times. We work in a really busy environment often, and so it's really tempting to leave your computer screens visible. Unfortunately, that's a great target for somebody to walk by, get information that they should not have access to. We also want to be helpful. So sometimes we get a phone call and we think we're talking to a vendor, we think we're talking to a family member, so we want to share information, but we can share information inappropriately if we're not careful. So again, we invite in those attacks at times that we shouldn't be doing. Keep your back to the wall. We want to avoid people that may be considered shoulder surfers, okay, or those that might be looking at your computer screen from the side. Sit with your back to a wall so that others aren't so easily able to see your screen, either behind you or beside you. That's a simple way to help protect PHI, protected health information. A little bit more on cybersecurity, you want to make sure you lock up. If you're stepping away from your computer, but you're going to be in view of it, like to answer a phone call, but it's all in one central area, just log out. Okay, so down here, you will see I have information for how to log out. On Rehab Optima, go under Activities, the log out, and it's much easier to log out, log back in that way if you haven't hit on those buttons already. If you're going to step away from your actual computer, make sure you log out and close the screen so that nobody can easily access the computer and all the information that might be on it. And certainly at the end of the day, be sure you lock up all your devices. So it is true that healthcare, kind of like banks and credit card companies and all those other agencies out there, healthcare is the 5th highest for ransomware attacks, because the Social Security number actually has more street value these days than a credit card number. Credit card companies have gotten pretty good at blocking any inappropriate use of a particular credit card, but Social Security numbers have a great street value when it comes to identity theft and so forth. Hackers are getting smarter and smarter every day. I can't urge you to have enough caution when protecting our residents' information. So we'll talk about HIPAA since we're talking about resident information. True or false, enabling access to a computer password may constitute a HIPAA violation. So simply allowing access to a computer password, is that a HIPAA violation? True or false? So with protected health information, PHI, don't store any on a laptop. Make sure you dispose of all PHI securely. Remember, we want to share the minimum necessary information only with those who need to know. And we'll talk about facility control to PHI in a moment. So protected health information, if you store it on a laptop, there can be a HIPAA breach if a computer is stolen. Password access to our computers, unfortunately, it's still pretty easy for a criminal to hack. One of the top ways that PHI is breached is actually through stolen laptops. So make sure you lock it up. Don't store PHI on them, like a Word document that has Mrs. Jones's home exercise program, that type of thing. Don't leave it on the desktop area of a laptop. If PHI is on a password-enabled site, such as through Rehab Optima or that HEP to go, the home exercise program to go, that we oftentimes do put exercise programs on, those are password protected and can be more safe. Be careful to dispose of all PHI safely. Make sure that your tracking grids, if you're on a facility who is using the therapy tracking grids, therapy schedules, even your Post-it notes that have little tidbits of information on it, that all contains PHI. Old insurance approval forms, when you read out your binders on a routine basis, all of that information needs to be disposed of securely through the facility's policy. Remember that part of the HIPAA rules state that you must never access more information than you need to know for treatment, payment, or operational duties. And you need to never share more information than is necessary for TPO as well. So keep that in mind when you're working with vendors, all right? You want to be careful about how much you're sharing with the vendor. They don't always need the backstory. Make sure you know who the POA is. Make sure you know who you're sharing information with regarding any of our residents and patients. And make sure that you're a little bit mindful when you're in the therapy department about what information you're sharing with your colleagues. Some of our teams are kind of large, and not all assistants are going to necessarily treat all residents. If you know something about a resident and the treating assistant needs to know, by all means, we need to share that information. But be discerning about what's gossip versus what might be actual medical information that the treating clinicians need to know. Be careful about that. And don't snoop. If that person's not on your caseload, you have no need to be looking at their chart. We've got enough details and information to keep straight. So don't snoop. It can put you in a bad light, and you could be accused of things that you would have no intention of really providing or performing. If a family asks to see a patient chart, this is where we need to give the facility control to PHI access. Their responsibility, one less thing we need to worry about. So if a family asks to see a patient chart, refer them to nursing and have nursing provide the information they're looking for. And this is because nursing, the facility is responsible for making sure that the person looking at health information is in fact the POA. They need to protect themselves, nursing does, by documenting who and when and how that PHI was accessed. They may choose not to do that, but we don't want to be the ones accused of not protecting PHI. So if a family is requesting to see a chart, refer them to nursing. Regarding HIPAA, with our emails, PHI needs to only be sent through our encrypted email systems. Don't send any kind of patient names, initials, medical record numbers. Any of those identifiers should not go through the regular email system. And be careful not to put PHI in the subject line, because believe it or not, that subject line may not be encrypted, even though the body of the email is. So you can just put on, Part B chart, or will you please look at, some kind of a tagline, but no PHI in the subject line. No texting PHI. I would think that would be evident, but our cell phones are not encrypted. So you cannot text any protected health information to the PRN therapist or to each other. And again, lock it up at the end of the day. Lock up all possible access to PHI, whether it's the computers, your clipboards that have schedules on it, soft charts, bulletin boards, binders. Make sure those are all locked up and not visible information at the end of the day. When faxing information, please be sure to use a fax cover sheet. Not only does it cover the intended document, so that if it comes off the fax machine face up, somebody walking by can't casually get information they should not be accessing, as well as it has a disclaimer on it, so that can help protect us as well in the event of a breach. Remember, no HIPAA goes on any social media sites. None of your personal social media sites should contain any HIPAA. And remember that employees have HIPAA rights too. So if you're an FRC and you have a new employee dropping off their TB test and some of that stuff for them to get started, that should be protected as well, because it is their protected health information, okay? Don't post any photos of residents or patients on your personal social media site. Even if they give their permission, there are times where there may be other individuals in the photo that did not grant permission. It's just not a good professional practice for any one individual to take on that risk of there being an issue with that, okay? And the answer, by the way, going back to that initial question, is true. Allowing password access, even if it's accidental, can constitute a HIPAA violation. So please don't have computer passwords out in a public area. That's why there should be like a facility data binder, hide it inside a known cupboard, but don't allow that to be out in the open, or it can be a HIPAA violation as well. So on with questions, true or false? Not protecting protected health information is only a HIPAA violation. True or false? So talking about resident rights, there's a lot of information on this, and this will be on our website as well if you want to refresh your memory on the resident right book that you read when you first signed up. But just a few quick reminders that a facility can seek an alternate physician if that physician of the resident's choice is unable or unwilling to fulfill the duties that the facility needs to have followed. Usually that comes to CMS regulations or state guidelines where a physician is not necessarily doing what he needs to do to help the facility stay in compliance. They can seek an alternate physician, or the resident can suggest another physician who will comply with the rules and guidelines. But know that when you're not getting certs back month after month, when you're having issues with the physician, the resident and facility have a right to seek an alternate physician, but you'd have to talk that over, of course, with your director of nursing to kind of find out what the real story is. Visitation times, the resident has a right to receive visitors at a time of their choosing, as long as that visitation does not impose on the rights of the other residents. Oftentimes, facilities will post their preferred visitation hours, so they don't get somebody coming in at 4 a.m. when they get off of third shift or whatever it might be. But again, that's up to the facility to do. The resident has a right to have a copy of their medical records, but they need to give the facility advance notice. And that's all well and good, and that shouldn't be a surprise to anyone, but bear that in mind when you're documenting your treatment encounter note. If somebody's been a little bit difficult to deal with or has had some challenging situations on a given therapy day, be careful about how you document that information in the treatment encounter note, because any note at any time can be read by a host of audiences. Be careful about what you document. And make sure you knock before you enter a resident's room, and make sure that they've acknowledged your knock, okay? So upon reasonable request, a resident has a right to have their room doors closed and not have them opened without knocking, except in the case of an emergency or unless having that door closed is not medically advisable and it's documented as such. Okay, so it's a courtesy and a right for a resident that we knock on their door, and that knock has to be acknowledged. So to answer the question, it is false. PHI exposure is also a violation of a resident's right. So again, that information, residents' rights, will be on the website under the employee portal. A couple of quick billing reminders. You want to see the handout that's associated with this presentation to review definitions. For evaluating therapists, unless it's a discharge to a hospital, make sure you have time scheduled with that person to do the research, a progress note, or a scheduled discharge, so that you have some hands-on and can incorporate your knowledge of the resident with what the assistants are seeing throughout the course of the week or 2 weeks, so that you can write the best document possible. And also with CPT codes, you want to make sure that you're being careful and accurate with your CPT documentation. Okay, so with CPTs, there should be a descriptor of the main codes in your therapy department, and that will also be on the website. And this includes some benchmarks that you need to be especially careful about when you're documenting. So, for example, they recommend some thresholds for therapy treatment of splinting, wheelchair fitting, E-stim, and that type of thing. And their recommendation, for example, for E-stim is 12 visits. They're not saying you can't go above 12 visits for E-stim, but you need to be really careful in documenting justification for going above those benchmarks. So again, with wheelchair fitting, with splinting, there are thresholds. We want to be careful with our documentation when we're going above those areas. We want to bill per the treatment code that we've provided. Don't lump all of your treatment under one billing code. So you don't want to do exercises and ADLs and standing all under therapeutic activity. Do separate it out for what you've actually done. The exception is if you've done only 2 minutes of putting on a sweater, that may not really qualify for separating out as an ADL code, that type of thing. The other caution I want to say is to not appear to be billing for one treatment in 2 different ways. So if I read a treatment encounter note and it says balance retraining under neuro and balance retraining under therapeutic activities, that appears to be doing one task and billing for it twice, which is definitely in violations of all kinds of guidelines. We don't want to look to be doing that. So make sure that you're being very specific about standing balance, maybe billing it under therapeutic activity, and trunk control, core strengthening, perhaps under neuro, and say one is seated, one is standing, and how are those tasks different? Make sure you show that those were different interventions, and therefore you're billing 2 different CPT codes. Some quick tips on state surveys. Remember that state surveys can impact your admission ability, and it can impact your managed care contracts. State survey information shows up on Nursing Home Compare, so folks may or may not want to come to your facility based on how many stars your facility has. And if there are enough citations against your facility, they can actually freeze your admissions as well from the Medicare, Medicaid programs. So again, we want to be as supportive as we can be for our facilities to have a positive state survey. There's a state survey checklist that will also be available to you through the employee portal and as a part of this handout packet. You want to be careful when you're responding to any kind of leading or potentially manipulative questions from the state surveyors. We're hearing of surveyors asking our therapy staff some questions like, do you think they're turning this particular resident every 2 hours? Well, we don't necessarily know because we're not necessarily checking on them every 2 hours. So a good answer might be, every time you walk by that resident's room, you peek in the door, they are in a different position. And so we're being honest, but we aren't necessarily being very specific, and we're certainly not going to throw nursing under the bus with this kind of answer as well. So be respectful, support the nurse's efforts while being as honest as you reasonably can. Be careful about those trick questions that they might be asking you. With infection control, true or false? Hand washing was immediately accepted as a good standard of practice when mortality rates decreased for the physicians who were actually washing up. True or false? That seems like a no-brainer, doesn't it? So infection control, there's a handout with this packet and on the website Know your ABCs for infection control. It's very current, came out in the spring of 2018. One of the easy things I want to touch base about is good catheter care. It can prevent 9,000 deaths per year. So very simple, easy ways to help prevent 9,000 deaths a year that we can make sure that we're maintaining and sharing with the STNAs if we see something looking a little bit sideways. We want to follow, obviously, universal precautions. And again, we need to be sure we're washing up. So with good catheter care, that includes areas such as hand washing, keeping the bag below the level of the bladder, making sure that bag is off the floor, and helping the residents to stay clean. And then we can all help decrease the UTIs and all those associated illnesses that can result in those 9,000 deaths per year. Okay. Also with that, know the ABCs of infection control. That might be a good handout to share with your DON. Very quick, very clean, easy way of categorizing what all these different diseases are out there and what precautions we need to take with those various infections that are going on. So the answer to the quiz is actually false, because physicians initially resisted the notion that hand washing actually mattered. The microscope hadn't been invented yet, so if they couldn't see it, they didn't believe in it. And even though hand washing was appearing to help with mortality rates, they didn't understand why. So hand washing was not popular until after 1865. People began then, when they found the microscope, they found microbes, they realized hand washing was actually a good practice. So make sure you're washing up between residents. As a quick wrap up, make sure you know your contact persons, FRC, area manager, regional director, your clinical compliance director, and certainly the corporate office staff with Phil and Kathy and Doreen. Any of these areas that you would like additional training on can be on CEU 360, and or you can Google resident rights for state of Ohio. All those resources have been provided for licensure laws. Sign up for our newsletter. Check out our website, register to use our website. We do provide good information through those mechanisms as well. So thank you for your time today. Have a great afternoon.